Uh, got it. Okay,
Go for it.
I'll edit this part out. Hello, everybody. The Nameless Narcissist here once again. Simple man diagnosed with NPD, giving you the facts on narcissistic personality disorder and things that go on in my head. If you like this video, please like, comment, and subscribe. But keep in mind, I am no clinician, but she is. It's so automatic to say that. I was like literally like spacing out as I was doing my.
It's slick. You're slick. You're like a pro.
Yeah, honestly. Okay, so this is Ruth Ann Harpur. She is a expert in treating not only narcissism, but also people who have been in toxic relationships with people who are narcissistic. Do you want to give a little bit of an intro about what you do, chemotherapy, maybe what got you interested in narcissism?
Well, I don't know what got me interested in narcissism. They just come to me. I attract them. Right? I'm a magnet. It comes up a lot in my work, and it was something that's interesting to me, and it's also a challenge, and I like challenging presentations. That's just what I like. So it's quite enjoyable, and because of that, I got interested in it, and I got a lot of support and supervision from Wendy Behery, who developed schema therapy for narcissism. And from there, it's kind of taken off. That's kind of just what I do in private practice. I work with a range of people. Not every, in case any of my patients are watching, not everyone I work with is a narcissist by any means.
They're like, oh my God, wait.
No. But probably the majority are not. But I have a kind of good handful of people who have survived abuse in relationships with someone who's narcissistic. And I also have a smaller handful of people who would identify themselves as narcissists. So that's what I do. And I also do a little bit of work with couples, where someone may have narcissistic tendencies. But it is not the only couple presentation I work with, just in case any of my couples are watching and thinking, does she think I'm a narcissist?
Which one of us is it?
Which one? You.
So that's actually a brief question I want to bring up. How effective do you think couples therapy is for like if one partner is a narcissist and the other isn't?
It's so variable. I wouldn't say I was super experienced in this area, but it's really variable. It really depends on the narcissistic person's willingness and ability to self-reflect and take some ownership, and whether they're really, really up for doing that.
That's also interesting. Yeah. How about enabling? Do you feel like there's also a struggle in kind of cutting off enabling behaviors in the partner and stuff like that?
Yeah. So if I'm working with a couple, I'm going to do work in parallel. I'll work with a narcissistic person on helping them. We can talk a bit more about schema therapy later, but really kind of doing schema therapy with them and helping them kind of get out of some of their more narcissistic coping modes and to bring a healthier, more grown up, more sturdy side of themselves to the relationship. But I also will work with the partner to help them look at how they're coping, which might well be people pleasing. It might well be pandering. It might well be not holding them to account and helping them to set boundaries in a very empathic and compassionate way, but also with taking no nonsense. Yeah. And then you find my experience is it quite quickly goes in one direction or the other. Either the relationship falls apart and you're done, the writing's on the wall, or the narcissistic person steps up to the plate.
Interesting.
Because they have to.
How fast do you think it should, like, how fast do you think, like, maybe how many sessions do you think it takes?
It's so impossible. It's so impossible to answer. And it also, look, often if people are coming to me for couples therapy, it's not unusual that they've already seen another therapist. Mm-hmm. So someone might already have been in therapy for like a year or two. And then it's like someone saying, it would really help you to have couples therapy on top of this.
True.
And that could be either party being in couples therapy. So it varies. It really depends on where people are at and their capacity and how much, what the strength of the narcissism is. I mean, if someone is constantly in a coping mode, whether you're constantly in a grandiose mode, there's no relationship. You're not relating to the person, you're relating to a coping mode. So that varies.
I mean, I feel like because I'm remembering before I was self-aware and constantly being on that defensive side, and how just, and when everything feels like it's attack on you, and you're basically just constantly like defend, and it looks, and like from my perspective, it is me, defending myself. But from their perspective, from everybody else's perspective, it looks like denial and minimization, stuff like that. Say, oh, I didn't mean to hurt you, and then they, whatever. It's a whole mess. So the next thing I wanted to bring up was like, a big thing I do is showing that all narcissists are different. We have different presentations, different things that we're even grandiose about, and stuff like that. Would you mind talking about like, maybe giving some examples about how narcissism has presented in your experience and stuff? And
narcissists are as varied as any other person. Not everyone with depression looks the same. Not everyone with OCD looks the same. I honestly, everyone is different. And you do get the stereotypical kind of person who comes in quite entitled, and they complain about everything, nothing's good enough, and they put you in. And but it can look like other things. It can look like I'm the biggest victim in the world. No one suffered as much as me, but it's really hard to connect with, because actually what that is a kind of like, I want to be the person who suffered, but that is my core identity, which is what people call vulnerable or covert narcissism. That's a presentation, and people can flip. Someone can flip from being that kind of more classical, grandiose narcissist to being that very vulnerable narcissist, but it's really hard to connect to. Yeah. That's the thing. Normally when people are genuinely vulnerable, it's so easy to connect. When it's really hard to connect, when someone looks like they're being vulnerable, it's like there's something going on here.
Yeah, that's probably one of your first clues right there, is because there's still grandiosity in that vulnerability. So to speak.
Yeah, absolutely.
How long do you, because like I get this a lot where I'm basically like, for the most part, people thought I was just bipolar before I was diagnosed. How long would you say it takes you to basically be like, unless it's one of those like very classical presentations, on average, how long would you say it takes you to be like, oh, I think I see what's going on here, more or less?
That is really difficult to answer, because most people coming to me have probably already seen someone else.
Okay.
So very often it's the other therapist who's like, can't work with this person, send them to Ruth Ann.
Gotcha.
And that sounds insulting. It's not. I mean, sometimes it's like, this is the end of my skill set. This is someone else's skills are better for this person. And sometimes they may have seen one of my psychiatry colleagues. So I do a lot of work. I work really closely with psychiatrists, which is really helpful with narcissism, actually. But so they come through them. So I'm rarely the first person someone sees.
Gotcha.
So it's really sometimes I have it in the back of my head. But if it's if it's someone just coming in totally fresh, I think you get a feel within a few sessions. Okay. But and I also think that comes with experience.
True.
That it's like, you kind of feel it in your gut. Kind of, I know what it's like to be in the room with someone who's quite narcissistic. I know what my reaction to that is.
Would you say it's more of like, you get the suspicion that they are a narcissist, or a suspicion that something's off?
Probably something's off, and then potentially narcissist. But you can't jump to that conclusion. Even as an experienced clinician, you can't fall too in love with your hypothesis.
Yeah.
You've got to really kind of talk to someone. And to be honest with you, when I meet someone, I'm not thinking, are they narcissist? Are they borderline? Are they da-da-da? I'm much more, because I'm doing schema therapy, I'm more interested in what are this person's core schemas? How do they experience themselves? How do they experience their relationships? How do they experience the world around them? What are the ways in which they cope with those experiences and that lens through which they see the world? What are their kind of modus operandi? What are they doing, right? And so in many ways, I don't care what the diagnosis is.
That's why the healthier.
It's not. Yeah, it's not at the forefront of my mind.
Because
sometimes people ask, "Do you think I'm a narcissist?"
Right.
Do you want to know the answer if someone asks?
Probably yes.
Well, it's a really interesting, because sometimes people ask and then not. And the other thing is, this comes up a lot with couples, where it's a couple and someone has basically concluded that their partner's a narcissist based on something they've read on the internet. And sometimes they're right, but they're not always. And
So, like,
they can really be misinterpreting behavior.
Yeah. Oh, yeah. I mean, I think I made a video on this where, like, disorders I feel like are commonly mistaken for narcissism is like things like PPD, OCPD, stuff like that, because all people know about narcissists for the most part are buzz terms like hoovering, discard, devalue, idealize, and like controlling and paranoid and stuff like that. Because, and like as you were saying, I think it's really good that you don't view it through the lens of, is this person a narcissist or not? Because I feel like that's what a lot of these people who either were in relationships with narcissists or feel like they were kind of fall into. They're like constantly on the lookout for any narcissistic trait, and they see one, they're like, oh, that's narcissistic, more or less.
Yeah, no, not always. And things that can get mistaken for narcissism, autism.
Really?
I've seen that mistaken, yeah, because the person's maybe quiet, maybe misinterpreting things, maybe quite rigid with how they see things. Okay. People who might be quite avoidant, coming across as lacking in empathy. So there's lots of things that if you start to look at the world through narcissist or not, yeah. that's not a good approach to diagnosis.
Yeah, it's hilarious.
That's not how you do it. But it is, and it's like, and to me, it's like, who cares? But so often the answer is no, I don't think you are, or I don't think your partner is. Sometimes the answer is, yeah. But what I always say is, when you ask me, am I a narcissist? What are you really asking me? Because it sounds like, am I the bad guy?
Yeah.
Am I the baddie? Can I be helped? Am I completely irredeemable as a person? And that's two different questions. Right. Yeah. So, and I kind of think, it's always, if anyone's asking me that question, and I do think they fit the kind of narcissism category, I would be really, really, this is what narcissism is. Narcissism is when you feel so shit about yourself, when you hate yourself so much, your only way to cope is by trying to present this perfect image of yourself, whether that's the person who's the perfect achiever, the perfect looking, the perfect lover, the perfect victim, the perfect sufferer, whatever form that takes, that's what it is.
Exactly.
Which is not the same as you are a bad person. And I always say to people, most of what you see about narcissism on the internet is BS. Yeah. And I don't want you to watch it, because even some of the sort of, I know we talked a bit about some of the abuse channels, sometimes they're very accurate in describing some of the dynamics of abuse. I don't know how accurate they are in describing the internal experience of narcissistic people.
I mean, I feel like, at best, they get some of the outside behaviors, right? I don't think they ever even delve into the internal experience. No. It's funny. No. I mentioned like the buzz terms and stuff because I once saw this channel, and it was like one of those typical kind of, oh, I was abused by a narcissist, whatever, maybe they were, maybe they weren't. But as I'm going through these videos, I noticed that they aren't talking about any sort of narcissistic traits. They use the hoover, discard, stuff like that. But they weren't talking about hiding the self or grandiosity or entitlement and stuff like that. It was just abuse, and they had to view it through that lens of narcissism.
Yeah. And none of those are clinical terms.
Nope, not at all. No. Neither is a narcissistic supply.
No.
Stuff like that. Thank you for validating that, because I had a whole thing on my channel where I like, guys, stop calling people supply, because that's weird and dehumanizing.
It's a horrible term.
Yeah.
I weigh, and I now use your term with my patients, self-esteem juice. So how do you get your self-esteem juice?
I'm making it a thing.
I used to say, how do you get your validation? But now I say, how do you get your self-esteem juice?
I love it. Oh, I love that so much. I do have to ask though, because you said narcissism is commonly for some people, mistaken for autism. On my TikTok, I'm like, are you sure you're not autistic? Quite a bit. Do I come off as autistic at all? I gotta know.
No.
Okay, just making sure, because it kind of gives me imposter syndrome. I'm like, oh my God, what if I'm autistic? I made this channel.
Not to me, but I haven't assessed you.
Fair enough. God, you can't give me a diagnosis? God damn it. Okay. Anyways, we kind of talked about it. Like, on the topic of terms, the term narcissistic abuse.
Oh, controversial.
We can tiptoe around it. I like most of my viewers know, and it kind of ties in what I was saying earlier, viewing the world through the lens of narcissism and how that can limit how we view abuse and stuff like that. And not to mention that it kind of implies that all narcissists are abusers, but that's not really what I'm focusing on with that. I feel like it's kind of implied.
Yeah.
So do you have any notable opinions on it?
Ooh. Well, I'll give you my opinion. I largely agree with you in that not all narcissists are abusive. Okay. And by definition, if you've got narcissistic personality disorder, it affects your relationships. It's going to cause hurt in your relationships. But we are all human. We all cause hurt in our relationships, right? It so happens that if you have NPD, you're probably going to be doing it more. But not everyone is as hurtful, as persistently, as severely, as pervasively as each other. There's variability there. So not all narcissists are abusive in their relationships. Yeah. And not everyone who abuses is a narcissist. Right? So you can't just conclude because someone was abusive that therefore they were a narcissist. I think there is a certain, this may be where we disagree, so it'd be interesting to hear what you think of this. I think the way I look at narcissistic abuse is if the abusive behavior is driven by a kind of narcissistic coping mode or a narcissistic defense. So it's like the person who ends up being emotionally abusive because they're so hell-bent on defending themselves and not being able to admit a mistake or apologize, that's driven by narcissism.
Yeah.
And the behaviors abuse. So that's where I would see it as narcissistic abuse. And I think for some people in that situation, whether it's that they've left an abusive relationship or they're in one, or whether it's not abusive as such, but it's really hurtful behavior. And where does it tip between hurtful behavior and abuse? There is, whatever. I think that can be helpful for the other person to have an understanding of what's driving that, and also understand their reaction to it.
Because
how does this affect you?
I do think that's like something that I find an issue with pretty consistently is drawing that line between abuse and being hurtful. Because in one of my relationships, I was cold, distant, kind of dismissive, and she calls that abuse, emotional abuse. And I'm like, well, I hurt you for sure. Is that abuse? I'm not positive one way or the other. But I feel like there's no in between for a lot of people of being hurt by your partner and abuse. But it's difficult to draw that line.
Yeah. Well, and it's also, you will hear some stories, and I hear some stories of abuse where it's unforgivable. Oh, it really is unforgivable. And there's other times when the behavior is hurtful, really, really hurtful.
Yeah.
But it's not necessarily that you'd be at the point where you'd say this relationship must end immediately.
Exactly.
And it's like, there is a spectrum.
100%.
Okay.
I do want to, because I do want to get on, I want you to talk about schema therapy a little bit, because I feel like we've just been kind of talking about the semantic narcissism here for a little bit. So
you're right. What do you want to know about? What do you want to know?
Well, maybe not me, if anybody were to walk into your office and be like, therapy me, what would it look like? What would the process look like, more or less?
Okay, so with schema therapy, probably explain the model of schema therapy. So schema therapy, we kind of talk about core schemas. So people have, the schema is your way of experiencing the world. We think about schemas as being about yourself, about other people, about the world you live in. So typical schemas in narcissism, I'm defective. Other people are abusive. The world is an unsafe place. Not the only ones, but those would be big ones. And those schemas, they are kind of all-encompassing. They're your belief system. They're how you interpret the world. So they're like a lens. They also have lots of emotion attached to them and lots of memories attached to them. So what you really want to do what I really want to do when I'm working with someone is I want to understand what were your experiences and how have they affected the way you see and experience yourself and your relationships and your world. And then I want to know, how's that affecting you now? So we have the schemas, and then this is the concept I find really helpful in schema therapy is we then have schema modes. So how do those schemas play out day to day? And that can vary for the same person. So in narcissism, we think about all schema therapy, everyone has a vulnerable child mode. Narcissistic people's hidden. They're like, oh, I don't have that mode. I got rid of that one a long time ago. It's like, okay, well, we'll be bringing that one back. yeah. Or hate that one. That one's not coming out, right?
Fantastic.
So, but that's that core child who has lots of unmet needs. Yeah, if you've got really kind of schemas that are really not serving you, you've got some unmet needs in childhood. Yeah. And then you have modes. So because of your schemas, because of your experience, you've developed ways to cope. So ways you might cope might be being grandiose, self-aggrandizing, bigging yourself up, making yourself special, being spectacular or extraordinary in some way. Another one being like really self-protective in a very aggressive and angry way. Another one would be being really detached in a kind of, and it's often a self-soothing way, although in narcissism it often looks really stimulating. So it's like drug taking, sex, and it often marries up really nicely with a kind of validation seeking. Like I'll take drugs, I'll go out, I'll engage in like really risky sexual behavior for the excitement of it, and then I get that little bit of validation. I also completely zone out and cut off. So that's so those are the most. I haven't met a narcissist who doesn't have an inner critic that uses them like a punch bag. It is just perpetual. You're a shit. You're not good enough. You're worthless. You're useless. And so if that's your inner dialogue in your head, no wonder your vulnerable child's hiding, and no wonder all those coping modes are going to come out.
It's really funny because I made a video on on how one of my ways that I kind of like look out for like, oh, maybe this person is a narcissist. I don't really focus on that too much, but I'll notice it, is that if over some minor thing that they did wrong, they're not going to be like, yeah, I fucked up here. They'll be like, I'm a fucking idiot because I did this wrong, or something like that. That harshness, you'll kind of notice in their speech.
Oh, so harsh.
Yeah.
So harsh. Yeah.
Not fun.
Yeah. And the other thing to say is that I have not met a narcissist who was indulged in childhood.
Yeah. Like people, because I feel like there's no empirical evidence to back up that whole thing of like, oh, like it can be a narcissist they're spoiled and stuff. I feel like they're confusing narcissism with just kind of being a spoiled brat, if I'm being honest.
Yeah. Yeah.
I just never had one at all.
Yeah. What I do see a lot of is young people, particularly adolescents, where they've had way too much freedom.
Yeah.
Far beyond, and it's not freedom, it's neglect.
Yeah. It's
like, yeah, you go out all night, drink, take drugs, get into all kinds of trouble, put yourself in really risky situations, and nobody stops that happening. Or yeah, you behave in ways that are aggressive and really bad for you, really bad for people around you, and nobody, in a very firm but loving way, says, hey, no, that's not how we treat each other. You're better than that. And you should expect better than that.
I feel like, and that also feeds into the kind of, because like people watch my channel and know that like, in addition to some of the things that went on, neglect was a large part of my childhood and, growing up and everything. And it feeds that need for independence. It's like, I survive alone, but I don't need anybody, blah, 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 blah. Which I feel like is, like integral almost to the grandiose self, or at least the starting point of it almost. Because I remember saying stuff like that when I was a kid. I remember telling my mom, I couldn't have been older than 12, and telling my mom that I'm basically independent. I don't need you. I need your house and some of the stuff that you buy me. I don't need anything else from that right now. And there's
a schema therapy paper recently that came out, I think it was 2020, and it kind of took, schema therapists are always kind of like describing new modes, but I kind of think, look, the labels are helpful insofar as they give you a kind of clue, but they're individual. But one of them was a hyper-autonomous mode.
Yes.
That's
Yes.
exactly what that is. It's like, I am going to be on my own and I'm going to be powerful and watch me go.
I literally,
And I
like,
sure as hell am not going to let anyone else give me too much, because I'm not going to be reliant, because then you can let me down. I'm not giving you that power.
it feels like I'm dependent on it, is what it's like.
Yeah.
Literally, it's like this. I have never needed anybody my entire life. Why would I need you now? Why would I need anything? And people trying to give me stuff, it feels like charity. And it's like, don't imply that I need this. You know what I mean? And it's almost insulting a lot of times. But once I had a buddy's mom offered me to, during college, stay with her because she knew my home life wasn't great. And I thought that she was like being almost condescending with me. I didn't say that outright to her, but I remember complaining about it to my friends.
That's how it felt.
Yeah. It was interesting.
Yeah. But she probably saw something in you that she wanted to take care of.
Yeah, maybe. I ended up fucking her son's girlfriend. So I mean, probably not much after that.
Maybe changed her mind after that.
Yeah. Oh my God. But yeah. Anyways, anything more on schema therapy you want to talk about?
Okay, so let's have a think. Where did we get to? Well, that's the model, right?
Yeah.
So then in schema therapy, you are always trying to connect with that vulnerable child. You do so much work negotiating with people's coping modes. I'm like, okay, this is your hyper-autonomous mode. And now, I think we talked a little bit, because we talked before, about chair work in schema therapy. So it's I'll put your hyper-autonomous mode on a chair.
Real quick, I once read a case study about schema therapy.
Yeah.
And I think what they called they called it like the guardian or something like that. Is that a mode?
Not one that I've heard of. Yeah, but schema therapists love to invent their own modes. Don't worry about that. But people have their own names for their own mode.
Really?
Like I have a mode, and I call her my teenage rebel. Yeah.
Interesting.
And she's feisty. And she's feisty. She can be very sarcastic, and she's not very forgiving. But I call her my teenage rebel mode.
Yeah. Ooh, okay.
Yeah, that's not an official mode, but it's my teenage rebel mode. Yeah.
We can get on that later. Go on what you were saying, because I just had another thought.
Yeah. So you kind of what I'm always trying to do with the modes, I think, is, you kind of have to realize these are the survival strategies, but they're outdated. So you kind of would be maybe saying, I might be saying to my teenage rebel self, hey, you're right. You're right about most things. You are, and you have a point, and you see things that are not fair, and you see things that are not just. But you know what? You don't need to come out all guns blazing with a ton of sarcasm and insulting everyone. I will handle this with a little bit more diplomacy. Yeah. Take a backseat, kid. It's all right.
Interesting.
But then I might also have to say to her, so this is how I work with my modes. Then afterwards, I have to check in with her and say, do you think I did a good enough job?
Yeah.
Sometimes she'll say, yeah, pretty good. And sometimes she'll say, no, you let them off. You let them off the hook too damn quickly. I'm going to step in again.
That's so interesting.
So it's like you have these kind of things in your head, right? So it's like you have the modes. And so, that's one of the sort of features of schema therapy, is to put your kind of chair work as part of it. It's like understanding those modes, understanding where they come from, understanding their intention. The intention is often a good intention. Yeah. The intention of the hyper-autonomous mode is to protect you from people letting you down. The intention of the angry protector is to stop you getting hurt.
Yeah.
Sometimes the intention of the critic is the critic's a different kind of mode. It's not really seen as a coping mode, but sometimes the intention is to make you so damn perfect that you don't make mistakes.
Interesting. So would you say would you say all modes in somebody has like a place, or do you feel like some of these modes have to be almost deconstructed, so to speak? That's a debate.
Is it? Okay. Yeah. Can you ever get rid? Look, we all have coping modes, right? Everyone zones out every now and again, right? That's okay. Everyone gets angry. I mean, I would never want to take someone's anger away from them. Anger's a beautiful emotion. It tells you what you really care about. It tells you what is so important to you that it offends you that you're prepared to really rage, right? So, yeah, no, I'll send you a beautiful piece of writing on anger because I give it to everyone. All my narcissists, I give it to them.
Oh, I love it.
And then not only narcissists, I give it to them. It's actually from a poet. But now where was I? I've lost my train of thought. What I would be thinking is I want you to develop a healthy adult mode. Yeah. An inner good parent who meets the needs of your vulnerable child. So you don't need the coping mode so much. And also, that's who steers the ship. So, like I said, I have my negotiation with my teenage rebel. It's my healthy adult doing that negotiation with her. And it's not harsh. It's not like, you gotta shut your face, you stupid kid, you know nothing, right? That would be my inner critic. It is
back down.
right, okay. But it is much more like, hey, kid, you're okay. We're good. I've got this.
I find those the dialogue between those modes really interesting in like the tone and the verbiage that you use, if that makes sense.
Yeah.
Do you feel like that's like almost a integral part of how schema therapy goes?
Yeah. Yeah. And it's also, if you have that healthy adult mode, have you seen the movie Inside Out? So they've got all the emotions, that it's like a little girl and she's got all these emotions in her brain.
Maybe the audience has.
Anyway, it's a great movie. But you want your healthy adult at the control panel. And yes, sometimes it's absolutely right and proper that you get angry. Mm-hmm. Right? And sometimes it's absolutely right and proper that you take control and you claim your autonomy. But it's doing that in a way that is calm and serves your needs and isn't terrified.
Interesting. Okay.
Yeah.
Damn. Honestly, like your tone always makes me so just like contemplative and like almost relaxed. I'm like, this is weird. But okay, so okay. Ooh, I had a really good question I was thinking about that because I'm sure you hear all the time people talk, at least online, how like narcissists like target certain people and a certain like type of person. Bullshit. Would you? Because honestly, but do you say that there are a type of person, so to speak, that narcissists at least attract, or anything like that?
I think we have my screen's frozen. Okay, can I edit that bit out? Okay, you there? Yeah. Okay. Yeah, so no. But I think there's a really interesting concept from couples schema therapy, and also schema chemistry, right?
Interesting. Okay.
And so I think if you are really narcissistic and someone comes along and they are very people-pleasing and very self-sacrificing and they don't like the limelight and they're very happy for you to have that, there's a bit of chemistry there, right? And they may also like, I like that hyper-autonomous Jacob. He's in control.
They get very upset when they realize I'm not in control.
Yes, right. So that that there can be that can be an attraction.
Yeah.
On both ends, right? And I also think that there are, the chemistry can work against you and often does in these relationships. But you can, as you get healthier, you can. That's a disaster. It's a disaster, right? That chemistry is not good for anyone, right? But I know when I work with people with diagnosis of borderline, when they get into a good relationship with someone who's healthier and someone who's a bit sort of calmer and sturdier, they often do really well.
Oh yeah, I imagine.
Do you see them and their presentation and their emotional regulation improve in a relationship? And that can be with a partner, but it can equally be with a few good friends. Personally, I prefer if it's with a few good friends because that's less likely to be a breakup.
Yeah.
But you take what you can get. Yeah. But the same with narcissists. As narcissists get healthier, I think I told you I had a boss, and I'm not going to give too many details. I don't want people trying to guess who they were. But I had a boss who I think was probably a healthy narcissist, but quite an extreme one. Like he was quite, he had high standards. He was a genuine expert in his field. Like he really was an expert, and he was amazing. And if you needed someone with his professional expertise, he's exactly who you would want. And his entire motto in life was, it's much easier to ask for forgiveness than permission, which is just entitlement, right?
It's something I very deeply believe, but
right. And I loved working with him because when you were like super junior, really new, he would just bring you along to things. And normally things that you weren't supposed to be in. And he was like, you don't mind if my student comes along, do you? And people would want to say, well, I do actually. But because I'm stood there going, you don't mind, do you? They'd be like, fine. And then I met his wife.
That line. I always do that. You don't mind, do you? Oh, that's funny.
And then I met his wife. And never have I met anyone as firm. She did not take any nonsense from him at all. She was amazing. But it's like, I think that probably is good for someone with those kind of tendencies, because the boundaries actually help you feel safe.
Because you need really, really strong boundaries with a narcissist. And like, I'm not saying that because they'll abuse you otherwise, but just like for example, I used to bring up this example all the time. I once had a friend who I would get very emotional, like around, not like directed at them, but like I rant about like people having wronged me or something like that. And she eventually had to have a talk with me being like, that makes me really upset. Like, and I feel like we need to draw a boundary there and stuff. And our relationship afterwards was like a lot better because I knew, hey, I got to vent to somebody else, or at least not get super emotional about it or ask permission and stuff.
Yeah. But that also, I imagine, how did it feel for you? For her to set those boundaries with you.
When she brought it up or afterwards? Because when she brought it up the first time, I felt like she was almost overreacting. And I felt like she was telling me that I was like too much. And so it was hurtful, but like I still went with it because I'm like, what am I supposed to say? You know what I mean? And it did end up, again, it made the relationship better and stuff.
Yeah. No, it does. And it that's what I mean. If you learn to set really good boundaries with someone, it can massively improve the relationship. And you can be quite surprised.
I have a feeling I know what this is a good segue into, but before I touch on that, I do want to ask a question, because this is something I used to say almost all the time. Do any of your narcissistic patients ever complain about their partners not actually caring about who they really are?
No.
Really?
No.
Interesting.
But most of the people I see who are narcissistic are single.
Okay, fair enough. Yeah.
Right. So they're probably complaining that previous relationships, no one really seen me, no one understood me.
Yes.
Yeah.
Okay. Yeah.
Yeah. So yeah.
Because that's a big thing for me. Like, I would be more back before I was aware. Obviously, I would be like, I feel like all these people fall in love with who they think I am, and then when they see parts of me that are real, they hate it and stuff like that. Or not feeling seen or understood. Blah 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 blah. Yeah. Same shit. But yeah, I was just kind of curious about that because I wonder if that was a common theme. Okay, anyways.
Well, maybe they're not saying it. Maybe that's too vulnerable to say.
True.
Yeah.
But yeah, cycling back, what was I looking for? Oh, having healthy relationships with narcissists, aware or not aware, your takes.
I think, well, it's not always possible.
Yeah.
Right? It's not always possible. So be really clear with that. I do not want to be quoted as saying that you should make your relationship with a narcissist work, because that's not the case. But, this is where I do have an issue. When you look at the kind of the narcissistic abuse channels, it's like, no contact, cut them off. Yeah. Right? And that works. That works if you've got a narcissistic ex with whom you have no ties. And you can just cut them out of your life. That doesn't work so well if you have children and you have to somehow find a way to navigate parenting together. And most people who have narcissistic parents that I've worked with actually love their parents on some level. Now, on a big level, right? They do love their parents. They may be infuriated by their parents. They may be pissed off with their parents. They may find them very difficult, but cutting them off is not even close to being on the table. Sometimes it is, right?
Yeah.
But I would say more often it isn't. And what they really want to do is find a way to navigate those relationships. And sometimes it's a parent navigating a relationship with a narcissistic adult child.
Oh, yeah.
Which is, and that actually, I've seen that where it's like, it's someone who's been in a very abusive relationship and they may have been able to kind of massively reduce contact with their ex, but then their adult child starts to show narcissistic kind of behaviors, and that's much more difficult. Yeah. And they don't want to lose the relationship. So actually, I think there really does need to be a shift or certainly introducing into the kind of discussion around narcissism of how do you navigate healthy relationships or healthier relationships, and from both sides of the equation. Yeah. How does someone who's narcissistic allow themselves to be seen a bit more in their relationships, and how do other people hold firm boundaries and navigate those situations? And it's with good boundaries,
yeah,
and empathy, and seeing what's possible. So I always say to people, implement good, healthy boundaries and healthy coping strategies, and I make no promises, but you'll see what's possible.
I feel like a big issue too is that in a lot of these relationships, they aren't viewing it as, these are the behaviors that I find intolerable, this is why I need to be leaving him or whatever. They're like, I think he's a narcissist, so I should leave him, basically. Which I feel like is not the most. I feel like knowing that they're a narcissist might be helpful in your decision making on how to handle that relationship, but that shouldn't be the determining factor of if you're with somebody or not. Does that make sense?
No. What are you saying? If someone's not a narcissist, you should stay?
Yeah, exactly. That's a really good point. Yeah.
I know
a lot of narcissists I don't want to be around.
Yeah, but you know what? It's like you have to look at each relationship individually, what it means to you, what the quality of that relationship is like. Someone might have some narcissistic coping modes. It doesn't mean they're abusing you. It doesn't mean it's a bad relationship. And there can be good things about relationships with narcissists. You're never going to be bored. I mean, that's one thing, right? You're going to have lots of stimulation because they like that.
I may be alive. At least I'm fun.
Right? Okay.
My friends actually say that about me.
But this is the thing. It's like at your best, it can be a relationship where there's fun, where someone's ambitious, where, if you think about the kind of healthy narcissism, being ambitious, having fun, working towards goals. These are good qualities potentially.
That sounds like almost an ideal partner if you can focus on the goods.
Yeah. And it's like, this is the other thing. It's like, people are not one thing. I think that as well. It's like, that's a whole sort of discussion about personality disorders. Does it define you as a person? And I'm like, well, by definition, those are the patterns that you're in your behavior and your ways of relating. But also, it doesn't make you unlikable or unlovable, or that there aren't lots of good qualities. And I don't know what I think about the term personality disorder. I know in the UK it's quite controversial. A lot of people just want to scrap it as a diagnosis entirely, or change the name.
I actually just made a video about that because like there is that discussion where it's like, well, one, renaming personality disorders, or there's some people who think that they just shouldn't be disorders to begin with, which I kind of suspect that people who are like, oh, our ideas of personality are just too rigid, they're actually personality disorders. I feel like they just might want to not treat people who they find treatment resistant, right? But at the same time, I'm like, it's almost I hate the idea of getting rid of the idea of personality disorders, because that almost makes it feel like I am more flawed it's like just me, you know what I mean? It's not a disorder that I can have. It's just who I am. I'm not mentally ill. I'm just a shitty person, basically. You know what I mean? That's what it feels like without narcissism.
Yeah. Well, the way I also look at narcissism as well is like, yes, you have your personality. Your personality disorder is not your personhood. It's not your humanity, right?
Yeah.
And all of us can develop new ways of interacting. You can develop new ways of behaving. You can develop new ways of feeling. You can have new experiences, which is the other thing in schema therapy speak, if we didn't talk about it, is actually is a massive part of it. And for me, I do it more than chair work, actually. Maybe I think partly because almost all my work is online now. It's all remote. Since COVID, I don't see people face to face, but you kind of go back into people's memories and get them to reimagine those experiences in childhood, and then you begin to go and change the story. You know, you go in, sometimes I'll go in and go into the situation where a child's being neglected, and I'll go in and start to meet that child's needs in their memories.
Nice.
And then as schema therapy progresses and you get more of a healthy adult, I'll say, well, let's bring your adult self in to look after your little self, which is very, very moving. And I personally think that's how narcissists develop empathy.
Interesting. So you think that like narcissists who, like for example, I lack emotional empathy, is what it is. And from some of the empirical, and this was through a psychoanalytic therapy model, I'm pretty sure. Like even the ones that, like they found that only 44% of narcissists lack empathy, but they did find that to be a more stable trait over time. So do you think that narcissists can genuinely learn emotional empathy?
Yeah. And this is, there's no empirical evidence on this. So this is my belief. Okay, so be really clear about this. And here's all we know: teaching people self-compassion increases empathy. Right? I think any kind of therapy that teaches someone to start caring and having compassion for themselves, even if it's their little self when they're a child, will begin to give them the kind of experience that starts to potentially foster some empathy.
Interesting.
You know? And also the other thing is, this would be really controversial. Let's just get cancelled. There may be situations in which a lack of empathy is beneficial.
Right. I believe it.
So, yeah. So, and I also think like you can have way too much empathy. You know, like when you're the kid who picks the broken toy because you feel sorry for the toy that's broken, because you feel, you know, like that toy doesn't care, right?
Right.
Yeah. Empathy is just getting you a broken toy there, right? But there are situations. If you think in the military, when you have to do something in the sort of acts of war. Yeah. How much empathy is helpful there, right? Yeah. I think there's some research that like surgeons generally have lower empathy than other doctors. Oh, yeah. And I'm like, well, yeah, are you going to cut into someone I couldn't do that, right? I couldn't do it. Because I'd just be like, oh, what if I hurt this person? What? Oh my God, what if it goes wrong and I'm going to be responsible? And I think about their family and there's so much writings. I'm going to be completely overwhelmed. My empathy is not going to serve me in that situation, right? There are times when a lack of empathy is not a terrible thing, right? But it's like, you know, I think you can develop empathy. Maybe I'm naive.
Maybe.
But, you know, I'm sure as hell going to try, right?
Yeah, I might as well.
Yeah.
Oh my God. That's funny. Okay. I'm looking through my notes right now because there's something that I wanted to bring up. Self-diagnosing and armchair diagnosing. I want to hear what you feel about those two.
You know, there are times when people recognize it in themselves.
Yeah.
And they're like, that's me. There are times when people rightly recognize it in a partner. Right? And it's not wrong, right? But you can't rely on that. You just can't. You can't. And, you know, no, you can't. And like I said before, you can misdiagnose.
Oh, yeah.
And the effect on a relationship of misdiagnosing your partner
especially with all of
narcissist or not. If you're diagnosing your partner as a narcissist, whether you're right or wrong, you're probably seriously hurting the relationship.
Yeah.
Now, you might be right. The relationship might be doomed anyway, right? But at the same time, no, I don't think it's helpful. I don't think it's helpful. I'm wary of it.
It's one thing to recognize your flaws and your partner's flaws and stuff like that. It's another to slap a label on it and then basically go about it through that.
Absolutely.
Because like I always say, it's like, do you suspect you're a narcissist? Okay, maybe you are, maybe you aren't. Go to a therapist, and maybe that you can work through that. Because I do hate when people are like, if you suspect you're a narcissist, that means you're not one. That's fucking stupid.
No. No.
Ooh, on average, just like, how many of your narcissistic patients suspect they're narcissists before you diagnose them?
I've never surprised anyone with that diagnosis.
I love. Oh, that's the answer I needed to hear. Thank you. Oh my god.
No.
Because it's the same. I see one of two people. It's usually like they know that something's off always, like universal. And a lot of times they're like, maybe I'm a narcissist, but they're not really sure. You go on the internet and fucking who knows. But then there's some of them that when they do find out, they're like devastated, and I feel like those are the people who were diagnosed way too early. I mean, like, I haven't read a case study where like somebody was who was it? Deanna Diamond. She says that there's two types of patients who are narcissists that come in: the ones that will never probably want to hear it, and then the ones that go in kind of wearing it as like a badge of pride, almost. Like they're like, yeah, I'm a narcissist, like whatever, like I'm cool. Yeah. I feel like it ties into this myth that narcissists are, animals who are incapable of self-reflecting.
That's not true.
Exactly. Yeah. There's some people who can be. We were talking about this before we started recording, but like there's narcissists who can be highly self-reflective. Yours truly, and some that aren't at all. But how many assholes have you met who are just normal?
That's true of other people. That's true of other people. And also your capacity for reflection varies. Yeah. For anybody, It's like my capacity for self-reflection varies. You can have a bad day.
Yeah.
And you're not reflecting. That's so it's people vary, including narcissists vary. And how able someone is to self-reflect also depends on the relationship they have with you. Like if someone knows me, if they trust me, if we've been working together for a while, and I'm like, dude, like, that you behaved. That was your coping mode out in action, right?
Oh, it's funny. I actually, like, when I was in high school, I had like one friend who I like actually trusted to basically interpret my behaviors, because I'd be like, I don't know what the fuck I did, and I basically rely on them to help me self-reflect, which was kind of a toxic dynamic, but let's not talk about that. but having somebody that you're, for a narcissist, that I'm sure this is true of other people too, that you can self-reflect with, more or less, can be like so helpful.
Yeah. Oh, for sure.
Okay, I think we've been talking about narcissists themselves for a little bit, so I do want to touch on some things to help the people who are not narcissists and would be watching this probably because they know somebody who's narcissistic or interested in. Well, first of all, let's see. Like, if somebody were to go to you and they want what would be your first piece of advice for somebody that was in a abusive narcissistic relationship that wants to get better and needs tools to do that?
Right. Well, I think, first of all, you've got to understand what that relationship is for you. Okay. Who have you become in this relationship? What parts of yourself have you lost in this relationship? Is that new to you? Is it a shock that this is like a relationship that you've been kind of sucked into and it's completely unlike anything else you've seen? Or is it pattern? Yeah, are these things that happen to you repeatedly? And I would be looking at what's the effect of this relationship had on your self-esteem? What's the effect it has on your ability to have healthy boundaries in your relationship? What if you lost friends? Have you lost your ability to work? Have you lost contact with family? And I would be thinking, well, let's just turn first of all to yourself and to building yourself up again. And I would also be thinking much more about how do you build yourself up? How do you start to relate to yourself in a better way? And I'll go to schemas as well, like what are your coping modes? And the coping modes are different, right? They're probably not the kind of narcissistic defense. Sometimes they can be. You can get angry protectors coming out from abuse survivors. You can get shutting off and dissociating, all of that. Those are the same similar modes in some ways. They look quite different. But, what are your coping modes? Where's your healthy adult? How do we build up that healthy side of you, to take care of you, to set boundaries, to have the courage to leave if you're going to leave, or have the courage to set boundaries and work in the relationship? Because sometimes, I would not suggest that if there's abuse, okay, hurtful behavior, where on the spectrum is it between hurtful behavior and abusiveness? If it's hurtful behavior, maybe you see what's possible, so that's what I would suggest. And there's lots of...
Yeah. Sorry.
Okay. And there's lots of good resources. And they're on my website. You can link to my resource page. I'm very proud of it because it's the one bit of my website I built myself. But, there's loads of stuff, like the Gottman Institute have loads of stuff on building healthy relationships. Sue Johnson's work on attachment and relationships, really, really helpful. There's so much good resources on boundary setting, all of that stuff. And the other thing, of course, is if you're depressed, if you've developed an anxiety disorder, if you have PTSD, get mental health treatment. And I think this is one of the things I do love about this work. And this is me being much more academic as a clinician. I think you have to be a bit of a jack of all trades to do what I do. And that's why I like it, because that's like, I get to treat depression and anxiety disorders and trauma. I also get to do kind of work on personality and relationships. So, it all kind of ties together.
Oh, yeah.
And you'll notice what I didn't say is sit and understand narcissism for hours and hours on end.
I was about to say, what I love about that is it's not a focus on the abuser or their pathology. It's a focus on how do I heal, more or less.
Yeah. There can be merit in understanding, if the other person has been narcissistic. I think there is some merit in understanding narcissism, but you have to understand narcissism, not the kind of caricature of the baddie, demon, narcissist, predator. That's because it's not accurate. Yeah. So, but if you can, sometimes I think actually understanding narcissism gives people empathy, but not sympathy, not justification, not an excuse. Yeah. But understanding what drove that behavior can sometimes help someone forgive themselves and understand why it was so powerful and understand it wasn't to do with them. Yes. That is helpful. And for that, I think Wendy Behary's book, Disarming the Narcissist, is really helpful. And Craig Malkin's book on rethinking narcissism.
I think that, and that's actually, I actually say this pretty frequently, of once you get to a point that you do want to understand narcissism, my channel isn't necessarily for people recovering from narcissistic relationships. I try to focus more on education, but people do use my channel as a means to, right? Yeah. And I see the value in that, but I feel like you need to get into that portion of your healing a little bit after you get past, repairing yourself and some of the other stages that comes in the grieving of a relationship like that.
Oh, yeah. Listen, first stage is, are you sleeping?
Yeah.
Are you eating? Are you getting out of bed in the morning? Are you leaving the house? That's where you start. That's in a really devastating abusive relationship. That's where you start. But I think sometimes that need to understand is it's a coping mode in itself. It's like, I've got to work really hard. I want to understand this. I want to make sense of it. I need to know. I need to know. And I can completely sympathize with where that comes from. But yeah, you may never know. The bottom line is, I can't diagnose by proxy.
Yeah.
I can't diagnose your ex. Can't. If I haven't assessed them, I can't diagnose them.
Yeah. And what if
there are times when I've said, whoa, that's in keeping with a kind of narcissistic behavior.
Yeah.
But the more important thing is, how did they treat you and how did it affect you, not what's the pathology underlying that.
Amen. Or at least, again, it can be helpful, but it shouldn't be the focus of your healing and stuff like that. I agree 100%. Speaking of, I want to touch more on, like, for people who have been in relationships like this before we dive back into narcissism, because I want everybody to be able to get something out of this. I feel like I had. Do you remember us talking about anything else to bring up? Because I'm trying to look through this. What surprised me, a narcissist focused on narcissism, right?
No, but okay. We'll have to think about what is how. Yeah, do you know? I think it comes back down to the focus on you. I mean, I hope because I started doing my channel, and I don't know where I'm at with my channel, to be honest. I'm kind of finding my way with it. But what I really wanted to do was to start having a different conversation, which isn't about narcissists or evil. So whenever I make videos about narcissistic abuse, I mean, I'll acknowledge some of the dynamics in those relationships and just how devastating they can be for everybody involved. But I'll always say, turn your attention to you. Turn your attention to yourself. Look after yourself. And turn your attention to other relationships. Because you may need to learn or relearn healthy relationship patterns.
Like there's one, I don't want to say who, but somebody made, like, a app in which you, like, count your days, no contact with a narcissist. And I'm like, how
like
is
stopping smoking?
Huh? Yeah,
like stopping smoking?
How is that fucking helpful, you to fixate on it?
Because I would be more concerned that if you're so obsessed with that, why are you counting? I don't count the number of days I've been out of relationships with ex-partners, right?
Yeah.
I don't.
That would be kind of weird.
You're still focused on them, right? I would be much more interested in, have you started to look after yourself? Have you started to, if you started to enjoy things again, have you started to re-engage with things that matter to you, with interests that matter to you, with other relationships that matter to you? Have you been able, how's your mood? How's your depression? Yeah. Are you having some joy in your life? Those are the things I'm interested in. There are times when that contact between ex-partners usually is just not good for anyone. And in those are the situations in which, why are you having contact? What is the purpose of this contact? There's no healthy purpose of contact here. So stop it. But other times there is. Other times you're having to have contact about children. Yeah. Or you're having to have contact about, if you're in the middle of a divorce, you're having to have contact about finances and practicalities.
I hear so
what does it mean?
Oh.
What does it mean? How many days no contact?
Exactly. I hear so often people will come to me and be like, did my narcissistic ex care about me, like, whatsoever? And I'm like, well, one, I don't know them. And also, like, I'm always like, why are you asking me that? But it feels like one, you're fixating on them, but two, it feels like you want an excuse to, like, almost go back to them. Like, that's kind of what it feels like. And also it's kind of insulting to them. But I mean, like, probably they did. I don't know.
Well, I would say what's underneath that question, right? Do I matter? Am I important?
Yes. Was I worthy of their love?
Am I worthy? Am I neglected? Those are the emotions that are underlying that, right? Is that sadness, grief, loss? Was I tricked?
Or not wanting
was
to
this
feel
person
like
just... Yeah.
I actually just had somebody DM me on Instagram asking about that. I try to answer my DM just because I'm a good guy. But she was basically like, she basically asked that question. Just the way she phrased it, I was like, she wants confirmation that he was the bad guy and she was the good guy in this relationship.
Oh, no, complete. You know what? I can sympathize with that, right?
Yeah,
I can really sympathize with that. And, you know, and sometimes that is healthy, because sometimes you have someone who's been in a relationship, and the way that relationship has worked is they've taken all the blame, they've done all the apologizing, they have pandered to the other person and every whim, and then they've got dropped. And the realization that, hey, this was not all on me. I let this person away. I had no boundaries. I let this person off with so much, right? That's a healthy and a good realization, right? But other times, like, would I love to tell my partner everything we disagree on, by the way, you're entirely in the wrong and I'm completely in the right? That's not the foundation. That's not sensible, right? And sometimes I think it's like, maybe it's painful to look at our own mistakes. Maybe it's painful to look at, how did I enable this?
Yeah.
You know, which isn't to come and say, well, it was your fault. It's not victim blaming. It's saying, well, how did I put?
White.
It's not black and white. And you know, I think back on relationships I stayed in for too long and think, why did I stay?
Yeah.
Does it make me a bad person? No. Does it mean I'm unlovable or incapable of a healthy relationship? No. But why did I stay in one that wasn't healthy? That's interesting. I should ask myself that question. I should find out the answer to that question, preferably before I start another relationship.
That's the thing, is that, like, no matter how, like, toxic or even abusive a relationship was, there's always things to gather about yourself, how you can have a healthy relationship, where your boundaries should be, what you actually want, et cetera, et cetera. I feel like people get so caught up in who was right versus wrong. And like that, again, anger, I feel like, can be a big part of healing, but it can't be your end conclusion, more or less. That's how you keep me in those relationships to begin with.
No. Yeah. Yeah. Yeah.
Okay. Also, how long has it been so far? I want to know if we're making like a 2-hour-long video.
We're 1 hour 25 minutes in.
Gee, whoa! This went way faster than I thought. Okay.
And now keep going. Listen, you can make 2 parts. It's fine.
I hate making 2-part videos. Nobody watches the second parts.
I'm gonna make a really long one. Just think of the watch hours.
Okay. Yeah. Exactly.
We're clocking them up. Yeah.
Okay. There was 2 things I wanted to bring up and then I will let you finish. However, like, if there's something you really want to touch on, or maybe even just one, like the narcissist losing their edge, the fear of not having those defenses, like that.
Every narcissist fears it. Mm-hmm. What was the other question? Because they might tie together.
I think the sympathetic joy as well.
Yeah, that ties in. Yeah. So, and actually, what we haven't talked about is fostering self-compassion.
Yes. Okay. Yes. Self-compassion.
Which I think,
which
I bet you've avoided because narcissists don't like it.
It was so
get that soft stuff away from me. I don't want any of that fluff. Right.
That's for weak people, not for me.
Don't want that weak stuff. I'm keeping my edge. Well, okay. So look, here's the way I would see that. It's like you really have to acknowledge those coping modes, or psychodynamic people will call them defenses. Pretty much same thing, different language, right? You have to acknowledge those have helped someone survive. And they are not inherently bad or evil. They're just not necessarily helpful now, right? And this is where I personally think, so in schema therapy is interesting because we have this big concept of you want to help someone develop a healthy adult. There's barely anything written on how you actually do that. There's a whole ton of stuff written about how do you take care of a vulnerable child? How do you cope with these coping modes? How do you confront the coping modes, right? And there's lots and lots of really good ways we can do that. We have nothing on how to foster a healthy adult. So every schema therapist wings it in their own style, right? Yeah. So, and the way I do it is I'm really focused on, well, let's develop compassion, right? And compassion is with suffering. That's what it means. with suffering. So I'm like, I want you to be with your own suffering. I want you to see that little you who felt so abandoned and abused. And you don't like it, but I want you to see him. I also want you to understand that those coping modes, they probably had compassionate intent. They wanted to alleviate your suffering. Yeah. Just so happens that a lot of the time they perpetuate it. Right? And then you're saying, let's find a new way. Let's find a new way. And it's kind of really helping someone to start to develop those softer feelings.
This is for all the other narcissists out here, by the way, not me.
Yeah, of course not you.
Yeah, not me. I'm above that.
Yeah.
Oh,
Yeah.
gosh.
Yeah. There's your coping mode slipping in there.
Yeah, but I mean, that's the thing, though, is that fucking, it is horrifying because, and there also is almost a grandiose element with a lot of these coping mechanisms, too.
Yeah.
I remember when I was first diagnosed, I went on the internet, did like your really surface level looking shit up, right? So I started delving into it. And I was like, oh, I'm the best manipulator ever. Fuck yeah, I am. It's stuff like that, you know? People, it's like, yeah, I'm emotionless. I'm cold. It was feeding my grandiosity. And that made me want to cling on to those things even more.
Yeah, yeah.
And I think that was hiding from the fact that the idea of not having things like that was more terrifying than anything else.
Yeah. But what if you get to keep some aspects of those things as a healthy adult? Because a healthy adult's autonomous, right? They're autonomous and they can lean on other people on occasion. And say it again.
Do I still get to yell at people?
Well, this is where you got to ask yourself, is yelling at someone going to help me get what I want and need in this situation?
Usually not, in my experience.
Right. But you may be able to be like, well, you know what? My angry protector, just like my teenage rebel, she's got a good point. What she has to say is really, really important. What she's upset about is important. Yep. But she may not be equipped for the job. But can you equip yourself for the job better? Can you be a better advocate for yourself?
Were we recording when you mentioned what you said about anger?
I can't remember, but I'm happy to say it again.
Anger, anger being a beautiful emotion. Go ahead.
It is. It's my favorite emotion, right? Because, and it doesn't matter if it's like from a narcissist or from someone who survived abuse, right? Yeah, anger tells you what you really care about. It's a beautiful line in it's a piece of writing. I'll send it to you, and it starts with, anger is the deepest form of compassion. Yeah, because it tells you there's something here that you care about. There's suffering here that you are enraged by. And if we can get underneath that anger, the vulnerability will be right there. Right?
My shame was underneath most of it.
Yeah. And so can you find a way? And I think the other thing with compassion is I think a lot of people see it as a kind of, I'm going to be soft, I'm going to do nice things, make myself a nice cup of tea, have a warm bath. It's not compassion, that's just having a cup of tea and a nice bath, right? Compassion is concerned with your suffering. And there's a really interesting concept. Here's Kristen Neff, and she talks about the yin and yang of compassion, which sounds like proper hippie shit, right? I get it, right?
Right.
She'll talk about the yin is what you classically think of when you think of compassion. It's that soft, tender, kind, nurturing side. But then you have fierce compassion, which is that strong. If you think about a firefighter, they're compassionate, but they're strong, courageous, and they have strength. I wouldn't want you to lose that. Right? But I might want to see if you can bring a little softness and tenderness alongside that. That you can have both. Maybe.
We'll see about that. Oh, man. I think that's a good place to wrap it up, though.
Get rid of it. I don't want to talk anymore about that stuff.
Yeah, we're not doing this again. No, I'm joking. But yeah, is there, before I do my little outro, anything else you want to share with the class? Well, actually, I'm going to link her YouTube channel in the comments and her website. Please, somebody remind me if I don't do that. ADHD, guys, I forget everything. But yeah, go check out her stuff. We are planning on doing an interview with me there at some point. Who knows when that'll be? But that is on the table. So watch that too. It's about me. But yeah, anything else you want to say?
No, thank you. It's been such fun. It really has been a treat. Yeah,
I learned a lot. It was very interesting going from Mark's psychodynamic stuff into schema therapy and stuff like that.
How was that for you? I'm curious because they're quite different. Like, look, I want to be really clear as well. There's no evidence that any model or any approach to therapy is better than any other for this. Okay, so I kind of think horses for courses. And the thing that's in common is the emphasis on a relationship. You have to have a good relationship.
It's interesting because I've always described psychology as, the allegory of Plato's cave?
No.
Where it's like, so basically in the Republic, I think Socrates described that people are like, it's like, imagine a bunch of people in a cave, right? And they're trying to interpret the outside world based on the shadows of the outside world on the side of the cave. And he describes philosophy as going outside the cave and like looking around, right? And like actually seeing the world. I feel like psychology is almost like watching those shadows on the cave and trying to put together a good model for how to play this all together, because you can never enter the personal experience of anybody. You're forced to look at the shadows on the cave. Yeah. So hearing you and Mark, it didn't even occur to me. There's ones that I think would be more helpful for me, sure, and portions of both that would be more helpful for me. But I'm viewing it as these are models that are trying to address the same thing, that are taking different strategies to do that, and neither one. I think it's more important about the individual.
I agree. And to be honest, I think it boils down to the individual and the kind of chemistry between the patient and the therapist.
Yeah. Oh, yeah.
There has to be some chemistry there.
I think at the end of the day, the model that you use might even be irrelevant compared to the relationship between the therapist and the...
I agree. I can tell you a really interesting conversation I had with my own supervisor. And I was like, I just show up and talk to this patient once a week and they're getting better and I have no idea why.
That's so funny.
And she just said to me, she's very sweet, she's very experienced, and she was like, really? After all these years, you don't know why? And I'm like, yeah, why? And she goes, I think it's the relationship. It's a relationship.
They're being heard.
You're giving them the experience of being seen and heard, and whatever clever techniques you have, it's just the relationship.
Want to know a controversial view I have on therapy?
Go on them.
I think the person who is being treated has a better idea of how to treat themselves than the therapist does.
Ooh, that's so narcissistic.
It is, yeah.
But I think, I think you're
is what I'm trying to say.
Yeah, but I also think, there will be an attraction to certain therapies over others, right? Yeah. And that can be a good thing. And I think if you have a choice and you feel like you've chosen a kind of therapy or you've chosen a therapist, that is a good thing. Yeah. Right. There are other times where I think people can be attracted to the very therapy that would be worse for them. And you see that sometimes, like people who've got serious anxiety disorders, who have a tendency to ruminate. I'm like, do you not go into psychodynamic therapy? Yeah. To ruminate and go over and over and over the same stuff. That's not good. And then you get other people and they're just like, I want a solution. I want a solution now. Give me that CBT. And I'm like, that kind of hardcore CBT style may not be what you need right now.
Yeah. Oh, that's fucking funny. I love that. Okay.
But otherwise, I agree with you.
Because I was like, okay, we're ending it. Get it. But yeah. Anyway.
There is one other thing if you want to ask.
Okay, yeah.
Do you want to say anything about therapists not wanting to treat narcissists?
How did I even forget about this? Yeah, okay. So here's my little spiel on that. Is that
Go for it.
okay? So we're people who have a mental condition, obviously. We have not developed a treatment method that is commonly accepted to treat it, and therefore it's hard to treat us. And we're classified as treatment resistant, where in reality, either the therapist doesn't want to deal with it, or probably, and I think this might be the more accurate one, we don't have a specific way to treat narcissism, like borderlines have DBT.
Yeah, most therapy for borderline isn't DBT though.
I think it's a good start.
Yeah, and no, it's a good start. It's not for everyone. Not everyone likes it. Yeah, I agree with you, but I also think there are lots of people who come to us and they don't come with a disorder that has a manual that tells you how to do treatment, and even when it does, nobody ever follows the manual because you're treating an individual.
Yeah.
Right? I think a lot of it just boils down to stigma towards people with narcissism. I also think some of it boils down to therapists, because therapists do tend to be often more self-sacrificing, people-pleasing variety of person. Yeah. And I think that can make treating narcissism quite difficult. But that's our shit to deal with.
Yeah.
And I think it's fine if someone says this is not a presentation I can work with for whatever reason, but that's different from saying this is a person who's untreatable. Yeah. And I think we really need to combat that stigma, because the bottom line is, as narcissism's got more into public awareness, there has been more demand from narcissists for therapy.
Yeah,
for sure.
And even if you look at it through the lens of, oh, narcissists are like, and obviously I don't hold this view, and I don't think you do it either, but like, oh, all narcissists are prone to being abusers, et cetera. Why wouldn't you want more therapists to be willing to treat them so that they stop doing stuff like that? I think it's a win-win for everybody, for the most part.
Yeah. I agree.
Yeah.
So yeah.
So that's
on that
note. we had to do some anti-stigmatizing stuff here at the end, guys. That's what I'm all about.
Cool.
Okay, but thank you so much for coming on the channel. I hope everybody enjoyed. Say goodbye.
Hi. Thank you, Jacob. It's been fun. It's been really fun. Thank you.
It has. I enjoyed this. Okay. Take your fucking meds, everybody, and go check out her channel. Bye.
Do you want me to stop recording?
Yeah, go ahead. That out me taking off my glasses.